Hi there. Welcome back to the channel. Today we will talk about calcium deficiency in postmenopausal women, causes, consequences, effects on diabetes and management. Introduction. Calcium is an essential mineral that plays a critical role in the maintenance of skeletal integrity, muscle function, nerve transmission, and vascular contraction. Throughout a woman's life, calcium is vital, but its importance becomes especially pronounced after menopause. Postmenopausal women are at significantly increased risk of calcium deficiency due to hormonal changes, dietary habits, and aging-related physiological shifts. Calcium deficiency in this population can lead to serious health consequences, particularly osteoporosis and increased fracture risk. This essay explores the causes, symptoms, consequences, and strategies for prevention and management of calcium deficiency in postmenopausal women. Understanding calcium deficiency. Calcium deficiency, medically known as hypocalcemia, refers to low levels of calcium in the blood or a chronic inadequate intake of calcium through diet. While acute hypocalcemia can result in neurological and muscular symptoms, long-standing deficiency often presents silently, eventually manifesting as bone demineralization and fractures. In postmenopausal women, calcium deficiency is more often chronic and insidious. Why postmenopausal women are at risk. 1. Hormonal changes. The most significant contributor to calcium deficiency in postmenopausal women is the sharp decline in estrogen levels following menopause. Estrogen has a protective effect on bone by inhibiting bone resorption, the breakdown of bone tissue by osteoclasts. After menopause, the decreased estrogen levels result in an imbalance between bone resorption and formation, leading to accelerated bone loss. 2. Decreased calcium absorption. Aging is associated with a natural decline in the efficiency of intestinal calcium absorption. This decline is exacerbated in postmenopausal women due to decreased levels of active vitamin D, calcitriol, which is necessary for calcium uptake in the intestines. 3. Dietary inadequacy. Many postmenopausal women do not meet the recommended daily calcium intake of 1,200 mg. Factors contributing to inadequate calcium intake include lactose intolerance, poor dietary habits, and reduced appetite, which are common in older age groups. 4. Vitamin D deficiency. Vitamin D facilitates the absorption of calcium in the intestine. Postmenopausal women often have low levels of vitamin D due to limited sun exposure, reduced skin synthesis, and decreased dietary intake, further compounding the risk of calcium deficiency. Symptoms and clinical presentation. Calcium deficiency in postmenopausal women may not be evident until significant bone loss has occurred. However, some early symptoms can include muscle cramps or spasms, numbness and tingling in the extremities, brittle nails, fatigue and lethargy. Consequences of untreated calcium deficiency. 1. Osteoporosis and fractures. Osteoporosis, porous bones, is the most serious long-term consequence of calcium deficiency in postmenopausal women. According to the International Osteoporosis Foundation, nearly 50% of women over the age of 50 will suffer a fracture due to osteoporosis. These fractures can be life-altering, leading to chronic pain, reduced mobility, loss of independence, and even increased mortality, particularly in the case of hip fractures. 2. Dental problems. Calcium deficiency can lead to dental issues such as periodontal disease, tooth decay, and tooth loss, as the body pulls calcium from bones and teeth to maintain blood calcium levels. 3. Cardiovascular and neurological effects. Though less common, severe and prolonged calcium deficiency can impact cardiac function, causing arrhythmias, and the nervous system, leading to confusion, memory problems, and depression. 4. Diabetes. Calcium is essential for numerous physiological processes, including insulin secretion and glucose metabolism. Hypocalcemia, or low blood calcium levels, can have notable effects on blood sugar control, though the relationship is indirect. One of calcium's key roles is in the release of insulin from the pancreatic beta cells. When blood glucose levels rise, calcium influx into these cells is necessary to trigger insulin secretion. In the case of hypocalcemia, this process is impaired, leading to reduced insulin release and potential elevations in blood glucose. Additionally, calcium influences insulin sensitivity. Low calcium levels may contribute to insulin resistance, making it harder for body cells to respond effectively to insulin. This is further complicated by increased levels of parathyroid hormone, PTH, in response to hypocalcemia, which has also been linked to decreased insulin sensitivity. Vitamin D, which works closely with calcium, also plays a role in glucose metabolism. Since hypocalcemia often occurs alongside vitamin D deficiency, this combination can further impair both insulin action and secretion. While hypocalcemia is not a direct cause of diabetes, it can worsen blood sugar control, particularly in people at risk for or living with type 2 diabetes. Correcting calcium and vitamin D deficiencies may support better glucose regulation in such individuals. Diagnosis. Diagnosing calcium deficiency involves a combination of clinical assessment and laboratory investigations, which includes blood tests to measure serum calcium, vitamin D, and parathyroid hormone levels, bone mineral density, BMD, testing and X-rays. Prevention and management. 1. Dietary intake. Postmenopausal women are advised to consume at least 1,200 mg of calcium daily. This can be achieved through dairy products, milk, yogurt, cheese, green leafy vegetables, kale, broccoli, bok choy, fortified foods, orange juice, cereals, plant-based milk, fish with bones, sardines, canned salmon. 2. Calcium supplements. When dietary intake is insufficient, calcium supplementation becomes necessary. Two common forms include calcium carbonate, best taken with meals. Calcium citrate, can be taken without food, better for those with low stomach acid. However, excessive supplementation should be avoided due to potential risks such as kidney stones and cardiovascular issues. 3. Vitamin D supplementation. Vitamin D is crucial for calcium absorption. The recommended intake is 600 to 800 IU per day, though higher doses may be required in individuals with documented deficiency. Vitamin D can be obtained through sunlight exposure, diet, and supplements. 4. Exercise. Regular physical activity helps maintain bone strength and density. Activities such as walking, jogging, dancing, and resistance training are particularly beneficial for postmenopausal women. 5. Pharmacological treatments. For women with established osteoporosis, medications may be prescribed. Conclusion. Calcium deficiency in postmenopausal women is a prevalent yet preventable public health concern. The physiological changes following menopause, particularly the decline in estrogen, make this group especially susceptible to bone loss and its complications. Early recognition and intervention through diet, lifestyle modification, supplementation, and appropriate medical management are essential to prevent osteoporosis and improve quality of life. Health professionals and public health systems must prioritize education and screening to mitigate the long-term consequences of calcium deficiency in aging women. Thanks for listening. Please like, share, subscribe and turn on notifications so that you will not miss out on the next video. See you on the next one.